Hello out there. April is National Brow Lift Month. That's actually not true. But in April, Austin Plastic Surgeon is going to be focusing on the brow lift. And as you will see, when we think about the brow and lifting the brow, the impact of that procedure is not confined to the brow. And we need to consider other adjacent anatomic structures and how they are impacted by, in a beneficial way, by doing a brow lift. More to come. The eyebrows are part of a larger region of the face called the periorbital region, meaning the tissues around the eyes. They're also part of the forehead, obviously, the tissue above the eyes going up to the scalp. And so when we're thinking about doing a brow lift and the impact that it has on the face, we need to think about the other structures of those regions. So the periorbital region is comprised of the eyebrows, the skin of the lower and upper eyelid region, also the temple, and then again, remember, the eyebrows are part of the forehead. So when we are thinking about addressing the brows and their appearance, we also have to recognize the opportunity and the impact of wrinkles on the forehead and around the eyes on any brow lift procedure. A brow lift does just what you would expect it to do. It lifts the eyebrows. And as we age, both men and women have descent or lowering of the eyebrows. This can create a less energetic, sleepy appearance. It also has impacts on the amount of skin in the upper eyelid, which creates the hooding and the excess skin. So we can already see a relationship between the eyelid skin and the brows. Because there's a direct relationship between the position of the eyebrows and the potential for excess skin in the upper eyelids, we need to recognize that in some instances, if there's a small amount of excess skin in the upper eyelids and low brows, doing an eyebrow lift can actually knock out two things with one procedure: elevating and shaping the brows and reducing excess skin in the eyelids. When someone has low eyebrows and a lot of excess skin in the upper eyelids, a brow lift alone will not treat the excess skin. And in those cases, to address the whole periorbital region, there's that word again, we need to do a brow lift, but also an upper lid blepharoplasty in order to reduce the excess skin. How does addressing the eyebrows impact wrinkles in the periorbital region? In particular, the 11 lines, there's a great example of them, but also the horizontal wrinkles that we have in our forehead. Well, when we're doing a brow lift, we can remove some of the corrugator muscles that create those 11 lines and replace it with a small amount of fat. That will help treat the 11 line type of wrinkle that is addressed or needs to at least be considered when we're doing a brow lift. The horizontal, straight across wrinkles that we have in the mid part and the upper part of our forehead, those are created by our frontalis muscle triggering, pulling up the eyebrow to put it in a normal position and treat some of the things that a brow lift treats, like the excess skin in the upper eyelids and the sensation of a lower brow. So then, if we do a brow lift and we put those and support those eyebrows in the normal position, the frontalis muscle doesn't have to contract. And when it doesn't contract, it doesn't bunch up the skin, and we no longer get as much, or perhaps in some instances, we don't get any horizontal wrinkles, except within the extremes of emotional expression, like a big smile. But we need to have a little bit of wrinkles, don't we? Just a little bit to seem normal in those situations. What type of wrinkles really aren't treated that much or changed that much by a brow lift? Well, the crow's feet, the ones that come out from the side of the eyes in the periorbital region. Because a brow lift is supporting the eyebrows and also potentially removing a little bit of muscle in the 11 line region, we don't typically see a significant change in the crow's feet. In some ways, that same supportive effect that we see in the brow region that diminishes the amount that the frontalis muscle contracts, that can sometimes have an impact in the crow's feet, but it's not a direct relationship. It's not as potent, as powerful as a brow lift is in terms of its effect on the 11 lines and the horizontal lines in the forehead. I already talked about the impact of addressing the brows on the horizontal wrinkles, on the 11 lines, and perhaps a very minimal amount on the crow's feet. Now, I want to make sure that everybody understands that sometimes there's not a big impact on any of those wrinkles, but in some patients, depending on their anatomy, the technique that is most appropriate, the efficacy of it, which is always variable, people do get a really powerful impact on the wrinkles, which is a wonderful bonus. And we always aim for that. We don't always get that. But the benefits of a brow lift alone, its impact on the appearance of the forehead, the periorbital region, that alone can make a brow lift, depending on the type, a very valuable procedure for patients to undergo who are seeking to reverse the effects of age. This wouldn't be a proper discussion of plastic surgery if we didn't talk about options and customizability, right? So, as you can imagine, there isn't just one type of brow lift. There are many types of brow lifts, but I'm gonna focus on just three because those three categories really cover the global ways in which different types of brow lifts can address specific problems. And of course, as you can imagine, there are limitations to what type of brow lifts that are done. And there's also the amount of recovery and how that might impact a patient's choice to have a different type of brow lift. So again, remember, there are gonna be three types, broad categories that I will speak of in the next segment. All right, now we're talking about the three different broad categories of brow lifts. And to make things simple, we are gonna talk about it in terms of the boom, boom, boom classification of brow lifts, right? It wouldn't be Austin Plastic Surgeon if we didn't mention boom at some point, right? Okay, the boom, boom, boom classification of brow lifts. First, there's B1. B1 has a little bit more of a limited impact, really just supporting and elevating the brows. Now, there's a specific issue that needs to be known when you're gonna consider this. This is one that is done through an eyelid incision, upper eyelid incision. So it's almost always paired with a upper lid blepharoplasty where we're removing skin, excess skin, through an upper eyelid incision. Another term for the B1, the boom brow lift is, and remember this is the one that's done with an upper lid blepharoplasty, is a brow pexy. What that means is that a suture is used to support the position of the eyebrow to the underlying bony structures by placing the stitch from the tissue beneath the eyebrow to the periosteum, which is the dense coating that is around all of our muscles. It gives good support. Now, in a brow pexy, you can use a variety of different sutures, multiple sutures, to give you a more powerful level of support, a more powerful degree of elevation. And if you combine that process with dissecting out more of the tissue just above that periosteal level, you can actually get a pretty darn potent brow lift and get wonderful results. The limitations are the following. You likely will not get any difference in the 11 lines or the horizontal forehead lines, and you probably are not going to get some of the elevation, or in fact, I should say, it's unlikely you'll get some of the elevation of the temple tissue and of the cheek that you can get with some of the more powerful brow lifts, in particular, the B3 brow lift. We talked about the B1 brow lift, the brow pexy. Now the B2 brow lift. That is a temporal brow lift. That is a brow lift where an incision is made within the hair, up in the temple region, and dissection is carried out down to the eyebrow. We can also dissect around the other tissues in the periorbital region, even some down to the lateral canthal region, and even some of the lateral temple. And those freed, those liberated tissues are repositioned in a more superior location to elevate the brow, and also to shape the brow to some degree. And then those tissues are fixated to some of the stronger tissues that exist on top of the muscles in the temple and also to the periosteum region. Now, when we do that, we also often remove a small amount of skin in the scalp where it's not noticed that it is gone in order to further supplement, to support that elevation process. We're on to the B3, the boom, boom, boom brow lift. Now, the B3 brow lift is the one that is the most thorough. It's an endoscopic brow lift, the one that I used to call a turbo brow lift. In that brow lift, we do an incision here, here, and here, and then here and here. And the leaf got in my way. And when we do that, we then use an endoscope to dissect at the subperiosteal level down to the eyebrows. We can also address those corrugator muscles that create the 11 lines. And we can dissect all the way down to the lateral canthal region and even onto the temple and some of the lateral cheek in order to liberate, free, elevate, support those tissues. So you can see how the B3 brow lift is the most thorough, the most powerful of the brow lifts. Now, there's that leaf again. And because of that, it also tends to have a greater degree of recovery, although I would not consider it a issue with regard to recovery. You just got to plan. For about a week. All right. So I'm going to talk about this a little bit more because the B3 brow lift definitely it needs a little bit more description. All right. We just talked about how the B3 brow lift, the endoscopic, the turbo brow lift, really reshapes, resculpts the eyebrows, but also the forehead tissue, the temple tissue, the lateral canthal tissue, if you so desire, and even some of the upper cheek. In that sense, it may be considered an upper facelift. I resist that terminology only because I think that it can create a little bit of confusion. But in reality, it really is lifting and sculpting and reshaping the upper third of the face. So it's a legitimate thing to say. I don't often use that terminology. And now we've got the wonderful term, the B3 brow lift. With the B3 brow lift, we make 5 small incisions within the hair. They're very difficult to see in time. We dissect underneath the skin, the periosteum, and even the muscles. We make adjustments to the muscles, and we reposition all of those tissues, and we secure it with some anchors to the bone in the upper part of the forehead. As you can imagine, if you're anchoring to bone, that's a very strong support. And then also to the denser tissue, the fascia that surrounds the temporalis major muscle, one of our biting, chewing muscles. So anyway, just to give you a good overview, it's a very thorough brow lift, slightly longer recovery, but very powerful, very potent. Now, as you remember, the B1 brow lift, the brow pexy, has to be done in conjunction with an upper eyelid incision, and thus is almost always done with an upper lid blepharoplasty. Well, what about the B2 brow lift? The B2 and the B3 brow lift. Remember the temporal brow lift and the endoscopic brow lift? Both of those also can be, and frankly often are, combined with an upper lid blepharoplasty to address some of the excess skin in the upper eyelid that may not be fully resolved by lifting the brows.